to the digital Telecare programme in Scotland. So in terms of the strategic background to the programme, there was an announcement back in 2017 by all of the main telephony providers in the UK that they would be switching off or decommissioning their analogue telephony network and migrating to a digital solution. That announcement had quite a significant impact on lots of areas actually in Scotland. Our area of focus is specifically around Telecare. So there are roughly around about 180,000 Telecare users in Scotland at the moment, and the analogue network is the main route that they use to connect with their alarm receiving centres to seek help in emergencies and other types of support. Back in 2017, when this announcement was made, the Scottish Government's Technology Enabled Care programme responded by setting a strategic direction to support services through that switch off. And the programme at that time aimed to address the challenge through digital improvement, integration and innovation. So in terms of the wider drivers for change, so I've mentioned then that we had this announcement that this network would be switched off, decommissioned and replaced by a digital solution by 2025. There are a couple of important points here. The first one being that 2025 was always an end date, and for a while now in Scotland there's been a range of work happening in the network, in the core of the network, which is impacting on citizens and on services in Scotland. On top of that, we've also recently seen announcements from some of the main providers that they have accelerated their timescales. So some of these providers are now working to a deadline of 2023, which gives us kind of a couple of years in real terms to support services through this transition. So urgency and a bit of risk to users if this transition isn't managed carefully. So partnerships really need to start looking at it as soon as possible. And that's fundamentally initially around making sure that partnerships can continue to deliver reliable and resilient services. Digital Telecare, the programme supports services through these challenges, and it also creates a kind of once in a generation opportunity really to redesign these services around the user and to make sure that providers can leverage and exploit the capabilities that a digital Telecare solution provides. Telecare has been around for a long time in Scotland, probably around about 30 years, and although it does a fantastic job in Scotland, I think anyone who's operationally involved would agree that it could probably be improved. It's a very reactive service at the moment. It does a fantastic job when it reacts, but there's an opportunity here to shift from a reactive to a proactive model. So just a little bit about the evolution of digital Telecare. So digital Telecare builds on existing analogue services. There are three main reasons for implementing digital Telecare. The first and foremost, as I've mentioned, is around ensuring that services can continue to operate post switchover. Digital also allows services to meet increasing demand and complexity. And it also, as I've mentioned, it gives services a unique opportunity to modernise and innovate and improve the range of services that can be offered to users. There are many benefits following implementation of digital Telecare. Digital Telecare gives services a much greater degree of flexibility around how alarm calls are routed and shared. It improves resilience and reliability for users. And I've mentioned this again, but it unlocks a range of opportunities around innovation to harness things like better use of data, link with citizens' own devices, use wearables, that type of thing. So to date, the programme has been working with a range of organisations to support them through their transition. A number of organisations in Scotland have succeeded in delivering a live digital alarm receiving centre, and there are a range of services at various testing stages, so everything from kind of testing on site through to deployment to devices to the field. It's anticipated that the first wave of live digital Telecare users will occur in early 2021. I had to change this slide recently because the previous slide had late 2020, and clearly the current situation that we're faced with has an impact on services' ability to prioritise this. So we're really keen to start kind of mobilising and deploy to citizens early next year. So far, the programme's facilitated a huge amount of learning around lots of really kind of key elements of digital telecare. Lots of these new areas are completely new to what have kind of traditionally been very locked down analog services. So there's lots of kind of really valuable learning being provided through these early adopters around things like cybersecurity, lots of the technical challenges, things like penetration testing. And all of that learning has been captured and has been distilled down and put into our digital telecare playbook. So the digital telecare playbook is a comprehensive and informative guide for services to access. It's hosted on the Digital Office website, and it's a digital repository which contains pathways including guidance and advice, things like supporting templates. So I mentioned earlier some of the challenges around things like penetration testing, data privacy impact assessment. Those areas are fairly new for telecare services, and what we were really keen to do was build a resource here that supports services that we know are already extremely busy and dealing with quite a lot of other priorities. So what we've tried to do with this resource is make it very easy to use, very user friendly, but actually there are lots of areas where partnerships can download or services can download resources, templates, guidance information on how to maybe complete things like that, and really kind of focus on the commonalities across digital telecare to try and save people a bit of time. Beyond the playbook, the programme is supported by a resource with experiential knowledge, expertise to guide and support, and international research. So in terms of the pathways in the playbook, they're all broken down at the moment across 3 phases: discovery, planning, and implementation. In terms of the pathways live at the moment, we launched the first pathway, the management pathway, which is really a kind of step-by-step guide on how to transition to digital. We launched that on 31st of October 2019, and we followed that up with the technical and security pathway, which was launched in March this year. And that was followed by the procurement pathway, which was launched in May. Moving forward, we have plans to introduce a range of additional pathways, and our priorities at the moment are stakeholder engagement pathway and workforce pathway. And since its launch in October 2019, 324 people have registered to access the playbook, which is fantastic. It's worth mentioning that all 32 local authorities in Scotland have registered, which is also great to hear. Some of the feedback we've had so far from partnerships has been that the playbook has significantly simplified and streamlined partnerships journeys around some of the complex areas I mentioned earlier, around things like DPIA, penetration testing, cybersecurity. So it's great to hear that the hard work from the early adopters has made life easier for partnerships that are on board into the programme now. The top 5 downloads for the programme really gives you a kind of sense, or for the playbook, sorry, really gives you a sense of where people are at in terms of their priorities. So the top 5 downloads for the playbook are supplier security questionnaire, outline business case, summary of alarm and peripheral compatibility, mobile connectivity FAQs, and data protection impact assessment. And that, folks, is my part of the presentation. I'm now going to hand you over to Hamish Johnson, who will talk you through the work that Maury have led recently around telecare and COVID.
So, good afternoon, ladies and gentlemen. My name is Hamish Johnston. I am a project manager with Murray Health and Social Care Partnership, but at this time I am the test manager for the technology-enabled care test of change on behalf of the Scottish Government. The background to our involvement is that Murray Council became involved with the LGDO in early September 2019. The basis of Murray's involvement was to purchase equipment to carry out a small-scale test of change using digital telecare equipment to help with our local planning for A2D transition. Our ultimate ambition being to consider where and how digital telecare could inform existing service redirection and models. We chose to test digital equipment from a supplier, Chiptech, who were already well established in Australasia, but it was fairly recent newcomers to the UK market. Their specifications appeared to provide some exciting functionality, such as the Go pendant, allowing users to increase safely their independence beyond the home environment when compared to existing systems. In the early stages of planning between mid-October and the end of 2019, a project brief, an outline project plan, initial risks and issues registers were developed and shared with LGDO. The project manager held several discussions with LGDO during this time to provide additional project governance and assurance as to our approach. Initial test scripts and scenarios were also developed by an interim project support resource. This resource was only available until the 31st of December last year. The project uses project management methodology. So how did COVID affect our plans? I officially became involved with the pilot on the 1st of January when I was appointed the test manager for the pilot after my previous project closed on the 31st of December. The original intention was to start testing in May 2020 for the pilot to continue until the end of July, with an evaluation report to be delivered to the Scottish Government by mid-September. This all came to a grinding halt at the end of March, when the pilot was suspended because the imperative became the necessity for the partnership to concentrate on core business and support. I was hived off to be the PPE coordinator for Murray. Up until that stage, we, the pilot project, had developed a project plan, a test strategy and a test plan. We were in the process of writing test scenarios and script and had started organising volunteers to take part as testers. The basis for this last point was a communication strategy and plan, briefings by presentation and subsequent training. So how did we deal with coming back after we reopened? The pilot was resurrected on the 27th of July as a result of a position paper in which it was stated that in addition to supporting the existing requirement to test Telecare change from analog to digital, the COVID-19 emergency had identified other benefits of a digital Telecare system. These were hospital discharge, daycare support, and doorstep deliveries. It took a little time to come back up to speed within the project. Apart from anything else, the dates of the project plan had to be updated and the test plan had to include COVID-19 guidance. One of the main issues was that we could no longer include briefings by presentation or conduct classroom. All would have to be done individually. It's interesting to note that although the administrative burden in arranging individual briefings and training took much more time and effort than had originally been planned, and the briefings themselves took over 2 weeks, the benefit accrued from individual briefings was that they were much more effective. People are naturally reticent in asking questions at presentations, and it also allowed the test manager, me, to meet the volunteers face to face and explain the detail in an effective manner, and to discuss any fears or problems that volunteers had. So what structure do we have at the moment? And I'm going to try and throw this up on the board. Just bear with me for a second. Can you see that? Okay. We finalized test plans, finalized scenarios and scripts, liaised with the volunteer development officer to recruit 28 testing volunteers. These are current volunteer test care responders. Enlisted a different ARC for the purpose of testing, a company called Astraline, developed and agreed DPIA SLAs with the ARC, delivered equipment to and briefed all volunteers gone live with testing on the 21st of September, started to compile results from testers, arranged weekly test results conferences with key stakeholders to discuss test errors and failures, ensure that we review and make timely changes to the direction of the project as appropriate, and also we're looking at areas that we might want to explore following lessons learned from COVID. We've drafted a baseline and end project surveys and begun drafting an evaluation report. I'm not sure how this is going to work anymore. So, in practical terms, what the pilot has already established is that the Go pendant is a game changer. The existing analog system uses a pendant with one button, which is only effective over a range of 100 meters from the base unit. All it does is activate an alarm. The Go pendant uses the latest technology and has voice communication with the ARC, GPS functionality so that the ARC can locate the pendant within 10 feet anywhere. We've had tests in London, Ullapool, the Borders, and Lancashire. And it also has an inbuilt fall detector. This new functionality at a stroke frees the client from being tied to the base unit. Other benefits being tested are, for instance, where a client with dementia doesn't know where they are, they press the alarm and the operator can guide them back to their home or get a responder to go to their location. Current plans are that the pilot will run until the end of November 2020. This is subject to review and may be extended if it is felt that to do so would increase or improve evaluation data. The test manager will complete a test report. The project manager will complete an evaluation report to be submitted to LDGO within 6 months. Within 6 weeks from the end of the test period. So thank you. If you have any questions, please feel free to ask, and I'll do my very best to ignore them.
Thank you very much, Hamish. Okay, as David mentioned earlier, my name is Colin McFadgen. I'm the project manager with the digital office, and so it falls to me to just try and close up a little bit. Following from what Hamish was saying there, I'd like to take a few minutes to discuss one of the other tests of change, which has been having some effect again since COVID hit. We did hope that East Ayrshire and Alzheimer's Scotland, who are running a test together, would have been able to join us, but they didn't have the ability to get people on board due to holidays and the likes. Initially, two organisations working together had intended to do a very similar design of tests of change using Telealarm and the Chubb system. And as you might expect, to roll out to people and see how that worked for them in a fairly limited capacity. Their rollout coincided with the spread of COVID-19, and similar to Hamish and Murray's experience, they had to adapt. How they managed that was to drastically speed up the rollout, and in fact managed to roll out 218 alarms, but doing this without the same evaluation as had been intended before. And therefore, when they were able to come back to the project after COVID response had started to calm down, what they intended to do, and what they do still intend to do, is to evaluate the rollout and to essentially work retroactively to look at how staff were involved in the installation and gather some information about some particularly interesting use of cases. So still looking at evaluation, but rather than that staged process that other tests of change have managed and have been intended to build on, they are looking back to see what lessons can be learned from a fast, high tempo rollout. This is something that, again, we'd hoped they'd be able to talk us through, because we haven't got that report through from them yet, but it's certainly something that we're very interested in looking at, because that's going to be quite an important lesson to learn for teams moving forwards. As David said, there's going to have to be quite an increased tempo in the production of this sort of project in the near future, in order to meet those tight timelines that are going to be coming towards us. So really what we've shown today is a couple of examples of how specific teams have reacted to the COVID crisis as it's hit, how they've dealt with capacity issues, and more importantly, how they've sprung back and how teams have gathered momentum again following the COVID crisis. And certainly, as David mentioned originally, all of the various issues that have thrown up around this, and what support we've been putting in place to try and help things move forwards. So really what I'd like to do now is to open the floor to questions and see if there's anything particular people want to ask. It's all very well us trying to present to you, but it's probably much more useful if we raise questions. Before I do that, David, you got anything else you want to say? I noticed your hand's just going up.
I've got a question for Hamish Collins, so when you're ready, I'll ask my question. Yep, I'll just go now if that's okay. Hamish, that was really interesting. Yeah, really interesting, Hamish. Thank you. It strikes me what you've done there is quite different from what happens traditionally in Scotland at the moment, and allowing users to access support from out with the home. Were there any operational challenges in terms of managing that specific piece?
We're still going through, obviously, testing. We only started it on the 21st of September. So the volunteers are still coming to terms with the functionality and beginning to send in their test results. What I've asked them to do is to send them in weekly. I think what you're talking about is the Go pendant, and it really is, as I said, a game changer, because it allows a client to, when they press the alarm, to actually talk to the operator in the ARC, and the operator can talk to them, so they can carry out a conversation. It also has, as I said, GPS, so that the operator knows exactly where they are. And again, as I said, we've had testers take their pendants down to London, and actually the project manager is in Liverpool at the moment, and she's carried out a couple of tests as well. So it's not defined by distance, and that means that the client can have a lot more assurance that when they're out and about, they can they've got that safety net, and the tests that we're getting back so far have proved completely positive.
Thanks, Hamish. That's great.
Thank you. There's one question chat from Ian Pearce. There's two actually questions he's put into the one part, but the first one is a question about the extent that ScotGov's approach differs to England and Wales, which have no digital strategy currently, in his words.
Yeah, I'll have a go at that, Colin. Yeah, so we're told that the Digital Telecare programme in Scotland is the only programme of its type in the UK. So, our approach is to work in a way that's kind of we describe as once for Scotland. And that's I think I mentioned this during my presentation, but it's to try and avoid duplication and avoid 32 local authorities struggling with the same issue. So the programme's been designed in a way that all of the kind of learning is shared across our network and hopefully saves people time and effort. So as far as I understand it, that's the only programme of its type around digital telecare in the UK. I do know, however, in Wales, there's a lot of really interesting work going on around Telecare at the moment around potentially kind of moving the model from, and I mentioned this earlier as well, but shifting the model in Wales from a reactive to a proactive model. So I think there's a lot of really interesting things happening as part of that programme. In terms of the second part, so how can SMEs have meaningful conversations and avoid the usual guff around artificial intelligence? Yeah, that's a good question. Part of our programme, part of the work we're doing at the moment is looking at how procurement happens in telecare at the moment in Scotland. So part of the conversation is around trying to make sure that market, a key part of digital telecare transformation, is allowing emerging and new suppliers to become part of the solution. So we're working at the moment with local authorities, partnerships and Scotland Excel to look at how the next iteration of the procurement framework might encourage and foster new suppliers entering the market.
Great, thank you. Hopefully that'll answer your question, Ian. Any other questions, folks? If you either call or put your hand, or if you put your hand up, then that'd be fine. Hamish, you just put your hand up.
Yeah. One other thing that I didn't mention during my presentation is that the technology that we're testing at the moment comes in three parts. The first part is a base unit, which mirrors the analog. The second part is, and that base unit has a pendant with it. The second part is the Go pendant. The third part is actually software, and responders can load an app onto their mobile phones, and the base unit can be configured to, the mobile phone can be configured to a base unit. What happens in practice is that when the client presses the alarm, instead of actually going first to the ARC, the alarm actually goes to a responder, and the responder can speak to the client through the mobile phone and the base unit, cutting out the ARC in the first instance. A base unit can have as many responders registered as is necessary. If no responder actually picks up the alarm, then the call is automatically diverted to the ARC. And we're exploring how that direct link between a responder and a client can actually, what advantages that gives us and what unforeseen benefits that will give us.
Interesting. Okay, thank you. As well. David, another one probably best started at you from Neil Britton. In terms of the shift towards a more proactive approach, what's your thinking with regard to SIMs being used?
Yeah, it's a good question, Neil. So at the moment, the early adopters are mainly using SIM connectivity as the solution, and that's based on the learning I mentioned in my slide deck. There's some kind of international research we've looked at. So that's based mainly on the learning from some of these programs, which are more advanced than ours across Europe and beyond. I think Hamish mentioned actually ChipTech were heavily involved in the transition in New Zealand. So lots of the learning has came from that. Having said that, I think one of the priorities for the programme over the next few months is to broaden that out. We know that won't suit all of Scotland, and we know there are connectivity issues around parts of Scotland, big parts of Scotland, that we need to support services with. So I think what we see over the next few months is a much more blended approach around different types of connectivity as a solution. And I suspect some of these will support the proactive approaches you mentioned, Neil.
I think Neil's put a second part on there. There's a few more to do with the cost regarding local and international SIMs and the impact on cost.
Yeah.
What you're saying.
Yeah, really good point, Neil. And actually, we've always anticipated, and we expect SIM costs to reduce for a whole range of different reasons. One, we would hope to put that into potentially any new procurement framework. And actually, we've seen some of the newer suppliers that are entering the market with significantly lower SIM costs. So we hope that trend will continue. But as I say, we understand that SIM connectivity, mobile connectivity, won't be the only solution. So hopefully that gives services more options. Hi, Thomas. I see you've got your hand up. Do you want to ask a question?
Thanks, David. Yes, I had a question for Hamish, if that's okay. Hamish, I was really interested in what you were saying around holding weekly test result conferences to track how your progress was going and making any adjustments necessary. And I was wondering if you could tell us a little bit more about any changes you found you did need to make as the testing progressed.
We have had one conference so far. We've got the next one is actually tomorrow. One of the difficulties that we're facing I'm facing is getting the volunteers to send in their result sheets. I provided them all with a spreadsheet, an individual spreadsheet, and I have a master which I copy all as the spreadsheets come in. I copy it into the master. What happens is that we have a rep from the ARC, a rep from ChipTech, and ourselves, and Colin from the Scottish Government. We go through. Don't need to go through all the tests that pass. Obviously, just identifying the tests that fail, why they fail, whether it's a connectivity issue, whether it's training, whether it's we're finding that quite a lot of the failures are because of the signal. Obviously, because it's digital, if there's no signal, then it's proving quite difficult. But ChipTech also have a functionality whereby they have a base unit with an extended antenna, and we're going to be testing those. So I suppose in answer to your question, as we progress and we'll look at the type of errors and failures that we're getting, I either escalate them to the appropriate organization. So it's local, and I'll deal with it if it's to do with training. We did have a number of failures to start with the ARC. Now, even though ChipTech and Astroline are actually in operation in several English councils, it was interesting that some of their operators were not fully up to speed and were getting the processes wrong. So again, having identified that, further training was given, and those errors have been eradicated. I hope that answers your question.
It did. It was really interesting. Thank you.
Great. Thanks, everyone. Then, if last chance for any last questions. People haven't been putting hands up, so I don't think there's anything left from anyone. No. Okay, Ian, you'd asked earlier about the Welsh project, and I don't have the direct details there, but you can certainly find out full details online if you go look there. The last thing I will do then is if I share my screen, and this is the details for the digital office. If any of you want to ask anything else offline or anything comes to you afterwards, by all means, contact us for that. And thank you very much for your attention.